Hello. Welcome to the Lunch and Learn about the new NCQA credentials. I am VP of Marketing Brian Krenzer and excited to have everyone here and would like to introduce our featured speakers. Whitney, can you put up the name titles? But would like to introduce you to Jen Gillespie, our Corporate Compliance Officer, and Mina Steer, our Senior Director of Credentialing and Audit. And with that, I will turn it over to our featured speakers. Thank you. Oh, one last thing. If you have any questions, please put them in the chat. I will be paying attention and moderating. And at the end of the presentation, we'll do a Q&A with remaining time. Thank you very much.
All righty. So, first thing we just want to share with you, this presentation, it's focusing on the new standards that NCQA released last year and go into effect right around the corner. So we will go over some key information here and help make sure you understand the requirements and you're prepared to be ready because it's right around the corner. Oh, and here you get to see our lovely pictures. So you've already heard Brian, Jen, and I'm the last one here on the right. So the first thing I want to talk about is the change that NCQA made going forward with a consolidated credentialing program. Previously, you'll see, like on the left side of that little chart, is they had two separate programs. The requirements, the standards were different and distinct. I mean, there was some similarities, but they were definitely completely different. What they've done going forward is they've created one consolidated program with two different levels of the credential you can achieve. So in that consolidated program, you could be credentialing accredited, which kind of points to their old program, which was called CR accreditation or credentialing and re-credentialing accreditation. The other level available in that new consolidated program is called credentialing certification. And that aligns very similarly to the old CVO certification that they offered. But going forward, it's one program, one set of standards that are applicable to all, with the exception of the certification program doesn't cover a few. And I really liked this. This I stole from NCQA. I love this slide because it really shows the differences in the programs. So one single program, but if you think about the standards for the quality, right, the very top line, those standards are the same in the certification as well as accreditation. And they also, if you're going to be surveyed, those will be covered. But if you go on down the chart, you'll see some differences, right? With credentialing committee, for example, it is in scope if you are going to be surveyed under the accreditation program, but it is not if you're going to be surveyed under the certification program. So again, so that's a change. And I'll tell you, you know, when you're, it's very real to me right now in our organization because we have both credentials, the old CR and the old CVO, and they both expire in February. So we're like, NCQA, what do we do? And they said, oh, well, this is perfect for you. You need to apply to one program, not two, and you'll apply for the, you know, to be surveyed as under the accreditation program. So it really brought some simplification for, you know, for me firsthand as someone that is very involved in the surveys. So that's one of the big changes that they have. The next, I think, very big change is the time frames. So for years, you know, NCQA has said, hey, a verification can be used up until X amount of days. After that, you better not be making a credentialing decision about it, right? You better refresh it. And for years, if you were in the orange fields, if you will, the CVO, soon to be certification kind of standards, your gospel was 120 days. You would make sure that generally, you can see a few variations there, but in general, it's 120 days was the rule. It's now switching to 90. So if a verification would get to the point where you verified it 90 days ago, which to me seems like a long time, but you can't consider it still valid and true. You'd have to double check to make sure that credential is still intact and in place. Now, on the green columns, the green headings, if you will, it's a little bit differently, because that is for making credentialing decisions. Generally, health plans are under that program. For 180 days has been that gospel, right? Always 180 days. That has now changed to 120. So it's much shorter. And so, processes, procedures, and just your evaluation needs to be a little bit different before you send that file off and call it complete. Additionally, I want to point out that if your business uses an external party to do the verifications, if you use a CVO, you need to be aware that that time frame for them is now 90 days, but your time frame is 120. You've got 30 days instead of before you had 60 days. I'm just doing basic math. CVO was 120. Health plan, 180, that was 2 months. Now, 90 and 120, so you have a month. So if you are doing monthly committee meetings and you're using an external party like a CVO to do the verifications, you might need to look at that frequency, because you could have edge cases. I don't know that we see data like that in this time where really push to the very limit, but there's always those edge cases. So you've got to be cognizant of those and make sure you're monitoring for them and you're avoiding those getting through. So then on the next change is with Medicare and Medicaid sanctions and exclusions. In the past, NCQA only required the sanctions be checked. But now in 2025, the standards include sanctions and exclusions. And the sources for each are different. So you see this grid that's got Medicare exclusions and the sources that are acceptable, and then Medicare sanctions and the sources that are acceptable. They're different. There's some overlap, right? But they're different. And as you go to the right side, you've got the Medicaid exclusions and the Medicaid sanctions, different but overlapping sources. So what we've done is put together, mapped it all and said, well, a simple path to get, if you will, the least amount of queries, the most bang for the buck, right? But to get the most amount of data would be to do the state Medicaid agency verification and an NPDB verification. That would get you, if you will, 2 stones, 4 birds, right? 4 sets of requirements above. Or another option, if you're not an authorized entity and you cannot run NPDB or don't for whatever reason, then you could do state Medicaid agency verification. You could check the Office of Inspector General list of excluded individuals and entities. We like to say OIG-LEIE because that's too long. Or then the System for Award Management, SAM.gov. So that would be, if you will, 3 stones and 4 birds. So those are 2 simple paths that you could employ in order to meet the new standards for all 4 of those verifications and 4 of those checks to be done. So that's a mouthful. Now, keep that in mind, because as you go into the next change we wanted to cover is with ongoing monitoring. So there's a lot of information on this slide, but let me simplify it. So those same sources that you use during PSV for M&M exclusions and sanctions apply here. Okay, that's a big change. And then the other thing is that NCQA has added the requirement to monitor the licenses that are expiring and or expired that don't get renewed. Okay, so that's brand new, right? So those are the big changes you need to make sure that your monitoring program includes. And then, of course, if you get negative findings like the license that is expired and doesn't get renewed, right, you're going to go down and there's a standard that says you're taking appropriate interventions, right? We don't want to leave a provider in our network that is not operating under a current license. So the time frame's 30 days, right? You want to be reviewing information within a month. So you can't let it get too stale and let it sit on the shelf very long. Then I'm going to move on to an application requirement that is new. And this one's kind of tricky in that NCQA says we want providers to be afforded the opportunity to give their race, their ethnic background, and languages spoken on the application. But we do not want them to be required. So it needs to be an optional data field, but it has to be added to the application or an addendum if you're using a state mandated application. And you need to offer them the opportunity to supply this. As well, you've got to communicate that you're not going to use it in credentialing decisions. You're not going to discriminate, and that it needs to be clear that it's optional. And so that's a requirement. If anybody is using CAQH, they collect so much practitioner data and they output it on credentialing applications. We are seeing evidence that they have made the changes in at least their main application and probably some of the others as well.
And just to add on to that, Mina, real quick, and also in our system too, we've added in that into our applications, and then for our clients that use CAQH, we set it up in the back end that transfers that information over. So we're ready to go for that. Just wanted to add that in real quick.
Yeah, I appreciate that. And I'm going to just tell you too, on that note, it wasn't easy. This, to add more data fields into your form and your system and your reporting and your deliverables and your output, sounds easy, right? IT went, oh, wow, that's a big change. 3 little fields, big change. But you'll want to be ready for that, and countdown is on, right? Credentialing decisions that are made July 1st should have an application with the content that supports this standard right around the corner. So then a couple more items. I guess I decided one slide was enough for these, but they're just as important. So fellowship verifications. NCQA, has always said, and they still say, fellowship verifications do not meet the intent of satisfying the requirement to make sure providers properly educated. Those education standards require that you verify one item, the highest, board cert or residency or the professional graduate medical school, right? One of those 3. But NCQA has now added that fellowship verification is required in certain situations. And it's under, I think it's factor 12, it's for directories. If you are going to communicate to your members, right, this information. So if you're going to communicate in your directory or otherwise materials to your members about this, practitioner, this information, then you need to make sure it's verified. So it's very specific. It does not change the education standard. That is static, but it layers on another education, if you will, program that may need to be verified depending on what you're communicating to your members. So, and then lastly, the quality program that you have in place. They are wanting, the standard says the goals that you set need to be SMART goals. That's an acronym I know I've heard in my lifetime over and over, but the goals of your program need to be defined in a way that is smart, that is measurable, that is attainable, relevant, and then time bound within a certain period, start and end date, right? So you'll want to make sure that you update your documentation about your program objectives and that you define your goals in a way that complies with these standards and that you measure them and you report on them. So that, I think, brings me to the end of my information that I wanted to talk about. And Jen, if you're ready, I'm going to turn it to credentialing information integrity.
Yes, I am ready. Thank you, Mina. Great information there. Now we get to get into the juicy credentialing information integrity standard. We are so lucky. Before we get into that, I just wanted to just give a little bit about myself. I've been in the compliance industry for close to 30 years now, with the latter half of that being in credentialing. I've done many NCQA, URAC audits, and really have come to understand and really grasp all of the requirements within. And when we get major changes like we did with NCQA, it really turns the industry upside down a little bit. We've been working really hard to get all of our ducks in a row, and we are set for that July 1st date. We've had to get ready a little bit sooner because it really depends on our clients when they have to do their delegation audit on us. And that correlates with when your accreditation audit comes up for renewal. So we've already done all of our credentialing information integrity items, and excited to help any way that we can with our clients to make sure that you feel comfortable with where we're at and to help you with anything that you might need help with. So let's see, I'm going to, all right, got the slides controlled. There we go. So this slide is a little history lesson on how NCQA got to credentialing information integrity. So prior to 2019, there was a significant number of organizations and delegates found to have changed credentialing dates on verifications, decisions, and notifications. And the findings reported increased over a span of 18 months on NCQA's fraud hotline. So in July 2020, NCQA added the CRED system control standards on policies and procedures. Then following up on July 2022, NCQA introduced the auditing requirements to demonstrate evidence of implementation and monitoring of the system controls requirement, which leads us to July 2025. So based on feedback from organizations, that includes us, we provided feedback, and also surveyors and an internal staff review, NCQA replaced the system controls requirements with the information integrity. And some of the feedback received was that there were challenges with system controls. There was a lack of standardization. There was an overemphasis on system access, functionality, and capabilities. And there was an all or nothing must pass scoring. So they took this feedback and improved the standards. They defined inappropriate documentation and updates, audit information integrity using standardized audit methods, specified an annual frequency, removed the all or nothing must pass scoring, and they provided detailed examples. And really with this presentation, we're just going through a lot of the basics, and we want to keep the presentation itself relatively short so we can do a lot more questions and answers. What kind of questions do you have that we can help provide answers? So now that we reviewed the history of how we got here, let's dive into the requirements. So CR2 is the Credentialing Information Integrity NCQA standard, and it has 4 elements. Element A is protecting the integrity of credentialing information, and that's the policy element, and it requires that the organization must have credentialing information integrity policies and procedures that specify the scope of credentialing information, and that includes how you will protect credentialing information that's applicable to your business. And examples of that could be would be practitioner application and attestation, verification dates, committee meeting minutes, etc. And the policy must specify the staff responsibilities for performing credentialing activities. And you want to make sure on this time you include the titles of staff. On the credentialing system controls, they did titles or roles, and we opted for the roles, but they've changed it where you need to actually list the titles of the staff. So we've done that update with our policy. And it must also include the process for documenting updates to credentialing information. So when appropriate updates are made, how is that documented? The when, what, why, who. It must also include inappropriate documentation and updates. And we'll get to this one on the next slide. And then it must include that the organization audits credentialing staff as well as the process for documenting and reporting identified information integrity issues. So this element is a must pass, but now you must meet at least 4 of the 5 factors for must pass for passing. So for system controls, the organization was able to determine what changes were appropriate or not. And being a delegate, we found that very challenging because of hundreds of clients, they all had their own policy of what was appropriate and inappropriate. And this really made it difficult for our system controls audit process. And we were continuously adding on to our policy. So now the information integrity is very prescriptive on what is considered inappropriate updates and documentation. 5 bullet points, that's it. They're falsifying credentialing dates, creating documents without performing the required activities, fraudulently altering existing documents, attributing verification or review to an individual who did not perform the activity, and updates to information by unauthorized individuals. Take a drink real quick. Thanks. So on to element B, the information integrity training. I really, really like this new element. Training and the knowledge that the work will be audited for fraudulent modification is a great preventative method. So you'll need to provide training annually to all your credentialing staff that includes what documentation and updates are appropriate, the 5 points we just talked about, and that the organization audits staff, documenting and reporting information. So be sure to include in the training about the responsibility of reporting findings to NCQA. This is also a great time to let staff know what will happen if the policy is violated. What are the consequences? So for Verisys, we actually added the info integrity training and the audit to our annual compliance plan because it's related to fraud, waste. It could be related to fraud, waste, and abuse, right? So I added the new CII training module to our new hire and annual compliance training that occurs every November. And this worked out great for us because the compliance training is mandatory for all staff and it's attested to by the trainee, and that attestation is kept in their personnel file, and the completion is judiciously tracked. So we are making sure everyone's getting it done. It's documented. We have all the evidence. And if you're looking for help with creating training, if you haven't already, HICE is a great resource. And I'm going to go jump up to this slide really quick. I just want to go over HICE. It's the health industry collaboration effort. It's HICE. And what it is it's a volunteer. It's a multidisciplinary team of providers, health plans, associations, state and federal agencies, and accrediting bodies, and they work collaboratively, that's a tough word for me for some reason, to improve healthcare regulatory compliance through education of the public. So if you go to iceforhealth.org or just do a Google search for HICE, and then once you're in there, you'll go to their library search and enter credentialing information integrity. And they have, as you can see here, they've got a training example, they have an audit tools, they have helpful hints, and it's been really helpful the audit tool that they have listed here is actually becoming now the industry standard audit tool. So if you haven't been to this website, I highly recommend it. We've actually used this tool for our audits, for some delegate audits, and we've passed many already. We've had a lot of clients that have done a delegate audit on the CII. So let me see, I'm going to go back. To element C. So audit and analysis. The organization annually performs audits for inappropriate documentation and updates to credentialing information. So the audit universe has been revised from what was the CRED system controls. On the old system controls, if your system did this and this, you needed to do that. If your system did this but not that, you had to do this. If your system didn't do this, or this, you had to do that. So it was a little complicated. But now, regardless of the system, you will sample from the entire universe of files. And this is regardless of any updates or modifications. So you're just going to check, you're going to check 5% or 50 practitioner files, whichever is less. And it doesn't matter if the 50 you checked had modifications or not. You just mark that there was no inappropriate modifications. And then you must have a minimum of 10 initial and 10 recredential files. And the 830 methodology can be used, but only as an option for delegate monitoring methodology. So if you're auditing your delegate yourself, you can use the 830 methodology for that purpose only. You cannot use it for your own organization audits. You must do the 5% or 50. Then once you complete your audit, if you found any inappropriate documentation and updates, you must conduct a qualitative analysis. And the standard is really prescriptive on what's required here. And they provide a lot of great examples in the standards, as well as that HEIST tool that I talked about earlier is great for this. The HEIST tool and the tool guide. It's fantastic. So I highly recommend that. Element D, improvement actions. So the organization implements corrective actions to address all inappropriate documentation and audit and updates found in the audit, then conducts an audit of the effectiveness of corrective actions on findings 3 to 6 months after completion of the original annual audit. So this is only applicable if you had some inappropriate findings during your initial audit. So the credentialing information integrity and the delegation agreement. So any new delegation agreements on or after July 1st, 2025 must address the credentialing information integrity. Any delegation agreements prior to July 1st, 2025, and they have the credentialing system controls addressed, you do not have to update the agreement to address credentialing information integrity. We have actually had quite a few clients that had the CSC language, but they wanted to update and they removed the CSC language and added the CII to our contractor delegation agreement. But it's not required by NCQA, but we have seen many organizations doing that. Then all delegation agreements in place prior to July 1st, 2025 that do not address the system controls must be updated prior to July 1st, 2025. So again, HEIST, the Health Industry Collaboration Effort, fantastic resource, highly recommended. And if you have any questions or want some help or want to see how we're doing things, feel free to reach out. And so with that, I will turn the time over to Brian for some Q&A.
All right. Thank you, Jen and Mina. That was fantastic. Thank you again for outlining and explaining everything that's gone into these changes to NCQA and how to best comply with it. We'll take questions now in the Q&A, either in the chat or in the Q&A. Want to reiterate, we will be sending out the deck and a recording of this webinar, so that way you have everything. You can go back and listen to the awesome content. And I know there were some questions or requests to move Mina during parts of this so you can see the full slide. We will send it out so you can see everything and have the full picture. But open it up to the floor. Would love to take any questions y'all have. Awesome. Great first question we have here from Anonymous. July 1st is only a few weeks away. How can I ensure my organization is compliant if we haven't deployed or developed a solution yet? Jen, Mina, what would you recommend if an organization is in that state of not having made hasn't deployed a solution yet?
Better get busy. The first thing that I'd say is that, time's ticking. But you might want to start with the requirements. If you think about credentialing as a process, right, the first part of it is really getting information from practitioners. So get that application form updated so that it's compliant. I think that's the first thing, right? Because on July 1st, you need to have that new race, ethnic background, and languages included. Now, if you are using CAQH, you might be covered, right? And you're like, okay, I got that one, right? The next thing that I think would be critical is to get your folks that are reviewing the administrative credentialing decisions and preparing files to go to committee to understand those rules on the time frame, because you do not want to approve something that now the data is not considered acceptable. So I think those are two things in just the steps of your operation that I would get on quick, like right now. And, maybe you could use the presentation that we provided here, as well as the heist training that Jen has shared, to make sure your folks are educated and get help so that those experts in your compliance department can implement those credentialing information integrity, CII new requirements, right? So I think really at this point, you want to get help, get experts in their respective areas or departments, spend an hour on a presentation. That heist one is really good too, and start dividing and conquering and getting ready. But in the meantime, the interactions with providers and with committee, I would make sure that those rules are in place now. Start now.
Yeah. And just to add one more item, because I believe those two are those would be the things you'd want to get started first. And just take a look at your delegation agreement or your contract to see if it has the system controls mentioned. If it does, you'll be okay. But if it doesn't, you want to make sure you get the credentialing information integrity in the contracts by July 1st. Our delegation agreement.
I really want to give a shout out to Heist. I think that the material, the information, it's long. Okay. It might be more than an hour. I don't remember, Jen. But it's very thorough on do this. Very basic roadmap to get everything covered. But like I said, immediately I'd start thinking about those things in the pipeline. It's like, wait a minute, I need to make sure this application is right. And I don't want to do that on July 1st, right? Because I'm looking at applications that are starting to come in now. So I hope that's helpful.
Wonderful. Next question we have is recommendations for how to best handle files in process on 7/1, so July 1st, or received back but not approved by committee for the start of the new standards. How would you handle those files that are in process, haven't been processed, and are now sort of going to be spanning the previous statutes versus the new standards that are coming up?
Yeah, so on July 1st, you'll want to enforce the new rules. So on July 1st, if you don't meet the application content, right? The date, the aging of the attestation is going to be key, right? The aging of the verifications, and make sure the content of those new fields, then they do not meet criteria to be approved. So they've got to be reworked to some level. So you got to recognize that and prepare for that. How much do they need to be reworked will be how deficient they are at the new standards. The one, like I mentioned to the other question, that field, race, the fields, race, ethnicity, etc. Those, you might need a one pager where you reach out to the practitioners and show that you did. Just so that you have that in evidence to prove that you're meeting that standard. And then aging, where you've got something that got too old, you've got to refresh those verifications and make sure that data hasn't changed. It can change one day later, but NCQA allows us a number of days, right, to be acceptable. So, I think you want to prepare your process and your staff for those edge cases that won't meet the new standards and need to have some rework done, and build that in. If you, in your July, if you've got recreds that are due in July, if looking at them early in the month instead of waiting towards the end of the month, right? Because you've got till July 31st to hit that July due date, would be another trick that I would employ. So, Jen, do you have other suggestions that you might consider?
Yeah, I think really what we've done as a company is we've already implemented the new standards right into our process so that we're ready for the July 1st. And if you haven't done that, I think that's going to be your biggest thing, and that's what NCQA will be looking for is the age of the verification, how if the timeframes are met for the committee decision. One thing that you don't need to have done by July 1st, unless you're being audited in July by NCQA, right, to get your reaccreditation, the information integrity audit just has to be done prior. It has to be done in the year 2025. Well, the standard year, July to July. And it has to be done prior to when NCQA is doing their survey. So, that's not something you have to really, that's something I hate to say put on the back burner, but I think, getting those timeframes and stuff in place is more important at this point.
Yeah, prioritize, right? To kind of look at the bucket of changes that you need to do, and then start with what's first, second, and third, and knock them off. I would escalate though at this point if you have credentialing delegation agreements that require you to meet these items, and most do, or if your organization is certified or accredited, then this to me would be an item I would be escalating up and saying, hey, organization, we might have a problem. Let's band together and avoid, and prevent anything negative from happening come July.
Cool. So 2 questions. Both of them I think are going to be related to how we Verisys support our clients. So I'm going to read those. And Nina, excited to hear. First is, at what point will you all, which I'm assuming means Verisys, be sending out the files with the new standards starting July 1st, 7/1, or earlier than that?
We've already done the development and switched on the new standards. So if you look at, so if you happen to be a Verisys customer and you are receiving data from us, let's talk about the application standard. The application standard's already in place, where race, the ethnic background, and languages are on the deliverable data file. And then they're also included in the packet that comes, the image packet. So if you get, we call it credentialing data transfer, such long names, CDT. That's how the data goes to our customers. And then they also get images that show, and you'll get that application image that has that race, ethnic background, and languages. So that's one way we've done the requirements. In terms of the time frames, we're not delivering to that. As our CVO service, the old rule was 120 days. So we're now delivering things. We've modified to the 90-day workflow rule. So we're looking, we're moving towards that now. We've already been doing it. So that's, those are the two big changes. The CII, we've already done the audits. We've already distributed our policies. If you're a customer and you need those, just let us know and we will get those over to you or your folks in quality and compliance too. If I didn't touch on a specific item that you're interested in, shoot a question back and I will direct that one. But we are right now in the ready state.
Great. That actually follows up very nicely to the next question we got, which is, since Verisys performs our CVO review and controls committee for our alliance, are there still potential tracking items that would need to be managed internally? What is your thought there?
Ooh, you went to robot mode.
If we're
there,
performing
Brian.
CVO, will... Sorry, what was that, Mina?
Sorry, you sounded like a robot to me, so I didn't get the question.
Here, I'll take it.
Right,
I'll
read this again. Since Verisys performs our
Since Verisys performs our CVO review and controls committee for KHA Alliance, are there still potential tracking items that would need to be managed internally?
No changes to the standards. So what you're doing, if under the 2024 standards, would apply to the 2025 standards. There's nothing new in that, if you will, that relationship. Other than, the delegation agreement, NCQA is looking that, before, if you did an amendment with us to have the credentialing system control language added to your agreement, like as amendment, you would want to make sure that you amended that to require Verisys to do the CII requirements. And many of our clients have already requested changes, and we've been processing those as they come through. So that to me is the one item that sticks out. Jen, can you think of anything else in the standard? So Verisys is covering doing the, if you will, historical legacy CVO activities, but also handling credentialing decisions, managing the committee. But I'm like, in those standards, I think we've got it end to end covered. Oh, asking that question made me think of something. The SMART goals. So even though you've delegated portions to Verisys, right? You still have a program, a quality program, the health plan does. You'll want to make sure you look at that program and make sure it's got the SMART, if you will, goals and objectives, the specific, measurable, etc. So I think you will want to circle back and make sure you're covered there. That's what immediately comes to mind.
And one thing, if you have specific questions about specific NCQA changes or what your organization and relationship with Verisys is, please email us. Please reach out to Spencer Robinson, who is the head of health plan, the head of sales and growth for this part of Verisys work. His email is srobinson@verisys.com. He can help answer any of these specific questions. We can get into the nitty-gritty and make sure we have everything set up for your specific organization, since there's always details that are a little tough to answer on the fly.
Yeah, that was a hard question for me, and I'm still reeling in my brain about it, because if you are NCQA accredited health plan, then you still have to check the box for all of those items when they survey you. You may get a pass if you've delegated to an accredited or certified organization where they won't look at certain reporting or certain criteria. They may not do a file review or as much of a file review. They may look at you differently, but you still, if you are under their accreditation program, you need to go through and make sure you meet those. Like, you'll need to meet the credentialing information integrity controls. And you'll have to make sure your delegate, Verisys, is meeting them. And then Verisys is, of course, meeting them. So there's some layers to that, if you will. So you want to go to, if I'm accredited, then I have got to meet these new accreditation standards. And if I'm delegating something, I need to make sure that delegate is meeting them. If you're just delegating to Verisys only, we're here to reassure you. We've been working on this since September 2024. So, like I said, we're in the ready state.
All right. Are there any more questions? I'm looking at the Q&A. I'm seeing Spencer send out his email, which thank you, Spencer. And we'll give this another minute or two. But if not, we might be reaching the end here, friends.
Well, that's fine. And like I said, I'm glad, Spencer, you confront the emails, but we will be glad to engage and assist as much as we can with this. So, please don't hesitate. We are in it together, And you know what we're hoping for? Because NCQA is getting ready to release changes for 2026. They're on a cycle, right? They start to release them in the summer, and everybody has the shock and awe in the fall and then gets ready for the July 1 date. And I'm like, please, NCQA, just give us some static, nothing come, in the next few months. Let us just settle into, with any change comes chaos, good change and bad change. So let us settle into this, chaos, if you will, and the new normal. That's what I'm hoping for.
Absolutely. Mm-hmm. All right. I think, unless I see something pop up here in the next second, I think we'll call this a wrap.
All right. When we hear crickets, it's time to wrap up.
Yep, I think so.
Thank you all.
All right. Thank you, everyone. Really appreciate it.
Yeah.